Another really big thing that's going to be occurring is the budget.
That's right.
And I think earlier today I was in a meeting where you were talking, saying that 89% of the budget goes to 3 particular areas, right?
Yeah, to educate, medicate, and incarcerate the citizens of Kentucky. This past budget, the budget we're in now, that number was about 85% to educate, medicate, and incarcerate. And so you can see those parts of the budget are really, and the 800-pound gorilla in the room is Medicaid. Mm-hmm. And it's, it continues to grow, and we don't have a lot of control over that growth. Mm-hmm. When I say educate, medicate, and incarcerate, I'm talking about our education budget. I'm talking about our Medicaid budget, and I'm talking about our corrections budget, and jails and prisons. So with that said, it doesn't leave us a whole lot of the budget left to make cuts in, and the word we're hearing now is that the budget, they anticipate us being about $300 million short in this next biennium. So that's $300 million in savings we have to find. They're also anticipating that the Medicaid budget will be short $200 million, so 200 and 300 is $500 million. Wow. Plus the when they figured the SEEK formula last year, they made a mistake in the SEEK formula, and it's about $50 million short. And then the ARC payments, actuarially required contributions to the pension plan, is another $50 million. So, we're up to about $600 million that we have to come up with next year. And so it will be an interesting session trying to find the money to make, next year's budget balanced. Now, we are not like the federal government, Gary. We have to have a balanced budget. We can't say, well, don't worry about it. We'll run in the red. We can't do that. Now, with that said, we do have some money in the rainy day fund, probably $150 million. So we could use part of that. But so it's going to be very interesting. And here's part of the problem. I said Medicaid might be $200 million short. Right now, at the beginning of last year, Medicaid was about 800,000 people qualified for Medicaid in Kentucky. Mm-hmm. That number's up to about 826,000 now. And when the Affordable Health Care Act is kicked in, or fully implemented in 2014, if it survives the court challenge, if it's implemented in 2014, we will have 300,000 more Kentuckians that qualify for Medicaid. So that'll make us about 1.1 million people on Medicaid, 1.1 million plus on Medicaid, and that's
quarter of the population.
That's 1 in 4 people in Kentucky will qualify for Medicaid, and we have to pay for that, and it's not cheap, and so we have some real issues out there, and we had to find the money, and I can tell you there's, things are, we can't raise taxes because everybody's paying all they can now. So we had to just find the efficiencies and in places where we can save money, and that will be a very interesting project, and you'll hear a lot about that as we go forward over the next 3 months. And January the 17th, on a Tuesday night, the governor will give his budget address, and we'll get the numbers from him. He will have updated numbers. His numbers will be more accurate than what I gave you tonight, but that's the numbers as I have them now.
Right. Recently, I did an interview with Barry Brady, the Marion County jailer, about another phase of a bill that went into effect in 2010, July 1st, 2010. But another phase went into effect January 1st, allowing more prisoners to be released, I believe it was 6 months prior to their actual release date. That was an effort to save money. Is that correct?
That's correct, and we're starting to put new programs in place now, Gary. The the majority of the Class D felons in the jail system are there because of drug-related cases. And, we're taking those people and locking them up, and we weren't doing anything to help them to re-enter into society, get them prepared to go back out on the street. So what we're trying to do now, we're trying to do more rehabilitation rather than incarceration. We're going to try that. We're trying to not only save money in the state budget, but also try to make sure that these people that are offending, that we find some programs and we get them the help that they need to get off the drugs or whatever the problem was, and get them back into society, and really try to help them where they don't come back. Right now, the way we're doing things, it's kind of like a revolving door. Somebody commits a crime, does the time, and then we don't do anything to prepare them to re-enter into society, or we don't do anything to help them with their problems, and within 6 months they're back in jail again. So we're really trying to not only, like I said, I guess the bottom line part of it was to save money, but an equal part of that was to help people to with their problems and with their drug addictions, and get them help and get them back out to live a productive life.
With these 6 months that were out early, were they getting programs?
They before they could get out, they all had to complete a SAP program, and that's a substance abuse program. So they all had to complete that before they were released.
So they had to complete that, and then they were eligible for the 6 weeks.
That's correct.
Month.
That's correct. They had to complete that SAP program first, and we talked about the Marion County Jail. The Marion County Jail has done a great job with its programs. Barry Brady has done a remarkable job, and he has one of the few county jails in the state, Gary, that has this SAP program at the jail. Now, one of the things that we're working on for him now is to try to get the state to up that number, to send more inmates to Marion County Jail, and maybe instead of 40 SAP beds, maybe he can have 100 SAP beds, and that's substance abuse program. And it's a very good program. I've been there. I've been invited there to talk at their graduation and several times, and they do a good job with that program. It's a very good program. So that's the kind of thing we're trying to do. And also the Marion County Jail, and I know Nelson County also has a very good jail. The Marion County Jail is the only jail in the state of Kentucky that's accredited. That means they accredited by the ACA, I think that's American Corrections Association. And what they did, they came in and they had a whole checklist of things that the jail had to qualify for. That cleanliness, the employees or the guards or the staff at the Marion Detention Center had to be properly trained. Had to make sure that all their training was up to date, the security was like it should be, and that the inmates were getting the meals that they required, and that each one of them had a place to sleep. There's a lot of jails in the state of Kentucky and across the country that there's inmates sleeping on the floor. So that was part of the requirements for this accreditation, is that they met all this criteria, and Barry has done that with the Marion Detention Center. So there's going to be 10 pilot projects in Kentucky that will give these jails, these local jails, additional inmates to do these SAP programs, and we feel like Marion County will be on that cutting edge and get some of those additional inmates.